Good morning, everyone. This is Dr. RG Rivera, and today we're going to talk about self-awareness. So I just want to give a quick background of what I do. I am a family psychiatric nurse practitioner in the state of Arizona, USA. I'm able to prescribe psychotropic medications and provide therapy to either the substance abuse population, child and adolescents, the general population, and the severely mentally ill. I obtained my doctorate of nursing practice at Arizona State University in 2017 and my master's degree in nursing at UST Graduate School in 2010. So the reason that I want to do this one, the self-awareness video, is because for our nurse educators, if you noticed, I did send an email which includes several videos that you can utilize for case scenarios or case studies. And I also put a note that you need to do a or your student nurses needs to do a pre-self-awareness activity before watching the videos. And what's the reason behind that? It is for the reason that there are some contents in the video that can be disturbing to others or can be a little conflicting or can share some conflicting emotions with our student nurses. So we just want to make sure that we're helping them in terms of understanding the concepts and moving forward with that. So with this short video, it's up to you if you want to have the student nurses watch it or if you want to do your own slide out of it. So it's really up to you. So self-awareness theory. So it is based on the idea that you are not your thoughts, but the entity observing your thoughts. You are the thinker, separate and apart from your thoughts. Why is self-awareness important? So it is important for our own personal and professional growth and development as nurses, and also for us to be able to provide effective nurse-patient relationship. It is actually being aware and paying attention to the way you think and feel. It is being mindful and being conscientious of one's presence. So technically, self-awareness is not only for psychiatric nurses. It is much applicable to other clinical setting because the ultimate goal is for us to provide nursing patient care, and the ultimate focus or the main focus is our client, not us. So we want to make sure that whatever our thoughts, perceptions, or misconceptions, we put it aside. So that is the main essence of it. So how do we put the self-awareness into practice? So basically, I've been doing this for years and years. It started with a 3-day, 2 nights self-awareness training with our mentor in 2010, and then everything follows. So I usually do self-awareness, especially if I have conflicting emotions with a specific population that I am treating, or if there is some build up emotion like an overwhelming emotion or anxiety and all that even before um, working. So first is we can put it in practice by doing journals. It can either be with a pen or a paper, or you can use your phone and jot down your notes. So it's more than a decade since I started doing journal, and it has been beneficial. The other the other thing that you can do is you're acknowledging your emotions by integrating feelings with rational thoughts. Self-awareness is also understanding oneself and the emotions of the people around you. It is you recognizing your own strengths, weaknesses, perceptions, and feelings, and being able to work through it. Also, self-awareness is expanding beyond your feelings or moving forward. So utilizing your inner selves in a better way. One of my mantra in life is we need to live by the moment, live in for today, because technically we cannot go back in time or we cannot move forward. And if you've noticed, because of the pandemic and everything that has been happening in our daily lives, which is, out of our control, um, the most essential thing is we live today. Also, self-awareness can also assist you in better knowing the situation and how to intervene and move forward. So these are the key points that I want to share. If you want to start doing self-awareness, or if you're doing it already, make sure that you make sure that you're honest with your own emotions. Again, this is for you and not for anybody else. Other thing is silence is your best friend in terms of doing self-awareness activities, self-awareness training. Also, you want to ask yourself about your own thoughts and actions, and accepting the fact that you don't need to know and you don't need to understand everything. So, ano nga ba yung common questions that we can use or you can use as nurse educators to you can use for your students? So, here here are the most common questions that I usually ask my own students or nurses. So, what is psychosis in your own views? What are your fears and worries in taking care of these individuals or this population? Why are you fearful of this individual's actions? What specific situation will you feel that way? If if I'm in my most fearful scenario, how will I intervene? And then how should I intervene? So again, I want to emphasize that as nurses, we need to always set aside our own thoughts and emotions, our own misconceptions and opinions, and make sure to provide patient care with the best of our abilities and to focus on our clients. At the end of the day, again, that is what we signed up for. So to better understand how to answer the questions, I want to share with you guys something personal. So again, I've been in this practice for about 4 years now. This is my fourth year. Um, and one of the most conflicting emotions that I am struggling for probably more than 6 months is treating substance use disorders. So yung ating mga nagsashabu, heroin, ano pa ba, so usually yung methamphetamine or shabu, and then heroin, opiates, narcotics, and all. So again, every time I have that conflicting emotions, I usually do the self-awareness training, or even if pupunta ako in a different state or country na hindi ko alam, I want to make sure that I do the self-awareness. So self-awareness technically can be done with any setting, but because of with this video, we're focusing on student nurses and how to help them in terms of making the most out of the videos and understanding themselves. So first question is, what is substance use disorder in my view? So in my own worldview, substance use disorder is about neurochemical imbalances. It can be, unfortunately, passed from one generation to another. Also, it is a poor coping skill due to adverse childhood experiences such as trauma, abuse, depression, and anxiety. So that is substance use disorder in my own worldview. So the second question is, what are my fears and worries in taking care of this individual? So to be honest, it's not because I'm fearful or worried, but maybe because of how I was raised, and probably because of my own not so good um, opinions or preconceptions about it. So technically, I was raised and grew up in the Philippines. So as we all know, in our society, where substance abuse disorder population are perceived as nobody, or sila yung mga, they usually, it's either they're in jail or they will be locked up in a rehabilitation centers without any medication management. Um, because technically people or the society thinks they deserve it. Another another yung another thing about substance use disorder population is yung kanilang mga actions, consequences of yung pagkalulod nila sa droga. So they commit murder, rape. So again, during this time, they need to be persecuted according to what society dictates. So again, this is not being political or something, but me making sure that I understand my own emotion, and I'm working to move forward, to be able to provide an effective care to my clients. So this is nothing political. So third question is, why am I fearful of this individual's actions? So I am fearful, not probably worried that whenever they relapse. So technically, I encountered several clients na maraming relapses. Relapses is mag-stop sila and then babalik sila sa pagkalulon. Mag-stop sila, so babalik sila sa pagkalulon. So as per as providers, what we do is we prescribe some medication for cravings, para hindi sila mag-withdrawal and all that, and then all of a sudden mag-relapse sila. So yun yung isang worry ko. Another thing is consequences of their action. So for example, yung murder or raping others and all that. Number four is, what specific situation will I feel that way? Most likely, ang medyo fearful naman ako. So not worried, but fearful naman ako in terms of them being combative and agitated. And again, it's not because they want to. It's because they have imbalances in their brain, diba? So, pero bakit ako fearful? So, that is the essence of the self-awareness. So, fifth question is, if I'm in my most fearful scenario, how will I intervene? So I will make sure that we are both safe. So meron kaming space. I want to make sure na malapit ako sa door, or na walang walang barrier sa aming dalawa. Wala siyang mahahawakan, madadampot na pwede niyang ihagis sa akin, or kaya kong lumabas ng pinto or mag-send ng quick email. And then also, I will be mindful of my facial reaction. So think about these individuals. They have imbalances in their brains. Of course, unstable yung mood nila. And the least that I can do is make sure that yung facial reaction ko will not aggravate it. So this is how I will intervene. So these are also one of the treatment modalities, which we call yung de-escalating, yung alam natin kung paano is sila i-de-escalate. Um, Sixth is, if I'm in my most fearful scenario, how should I intervene? So, ano yun mas dapat kong ginagawa? So, in addition to my answer, answers on number 5. So I should be that person who will treat him as a human being regardless of his actions because this is what I signed up for. So also his actions will not sum up his existence. So again, I've been doing this for years and years, same as with with a self-care with the self-care activities. So the reason I want to share with you guys is because I want you to feel now I'm not perfect. Nobody's perfect. We have, again, we're gonna have our own opinions and all that. But in terms of moving forward in providing the best care possible, we need to make sure that we set aside all of those mindsets and opinions. And so this being said, here in the US we have a specific training to be able to provide um, medication assisted treatment for our substance abuse um, population. I've been putting it aside for more than a year now, to be honest. Kahit na they're calling my attention because they want me to do it because of my own conflicting emotion. And then yesterday I just want to start doing it, kasi I mean again, we this is what I signed up for. This is my purpose. So with that being said, your clinical instructors or nurse educators will have you do the self-awareness activities. I just want you to always remember the key points that I discussed and make sure that you're making the most out of it because at the end of the day, this is all for you guys, okay? And that's about it.